Uh, so we are here to perform a colonoscopic procedure. He is Mr. Ikramullah, 20 years male, and he complains of altered bowel habits for last 1 year associated with the bleeding per rectum, and he also complains of weight loss for last 1 year. So just sign in the patient. He's Mr. Ikramullah, 20 years, and his MR number is 10947, right? And we are about to perform the colonoscopy in this patient, and the consent has been given by Mr. Sawat Mohammed, his father, right? So Mr. Zulkarnain will proceed with the procedure, and he will be supervised by Sir Paul, supported by, coached by Mr. Paul.
Paul, hello. Can you hear us?
I can hear you faintly. Faintly? Faintly. Hello?
Yeah, yeah, we can hear you, but also faintly as well. We'll get it fixed. Paul,
Yes, sir.
can I check the height of the patient and the the ergonomics that I'm sure you've already discussed. So what would you is your preference how high the table should be?
Could the volume go up? We can't hear Shamil. See how that opened it up? Take your time.
Paul, can you hear us?
You're very faint and very raspy. It's not
Okay, okay,
coming
let's
clear
we'll
whatsoever. Sorry. Right. So you've got your scope over the top. You need to step to your right a little bit more. That's done. This wrist is see how this wrist is done this? This wrist needs to be kept straight. That there. Sorry, Shamil, can't hear. Slow down. You've now started to breathe a little bit quicker. Slow down. Your shoulders move. That's good. Now, take your finger away from the blow. Good. Keep your finger away from the blow. Stop blowing. That's it. If you look at the screen, you'll see that there's a little bit of that on the screen. Why? No, you don't need to yet. That's just a little bit of mucus, tiny, small amount. Nothing to worry about. So what you're doing here, you're coming around the fold. Can you see it? Stop. You're coming around the fold. This is the lumen. And you're here, and you're pushing the fold up. So come back, then look up, and advance by a centimetre.
Hi, Paul.
Hello?
Paul, can you hear us?
I can now. That's clearer. Now
That's
I can hear.
okay. Your voice is a bit faint. I think they need to maybe change the mic
Oh.
because
You
we
want
could
me to
hear Dr.
shout?
Ravi really well, but we can't hear you really well.
Okay, oh, that's not a problem. You don't really need to hear me too much. You're cocking your wrist again. And what you're doing is that you're doing this. See the apex there? Hold on.
खत्म हो
Don't do
गया काम
anything. Look at the apex of the scope. See it? So it's changing what you're doing. Stop blowing. Good. Slow down. Good. A little bit of it there. Slow down. Now stop. I said stop and he just went out. So draw back the scope. Right. Just a little bit clockwise thought. Yeah. Change. Stop. Anti-clockwise. Stop. Now go forward. Don't just go forward. Keep the lumen central. Go forward. Now what we can do is because he's had some discomfort, we can consider quickly. If you look
Hello,
at
Dr.
the
Noel. Can you
scope
hear
guide,
us?
you'll see the tip of the scope is below the
Yeah, we
apex
can
of
hear
the
you
loop.
really well now.
If that's the
Okay.
case, you won't be able to reduce his loop. What you need to do is apply anti-clockwise,
Ravi, make sure we can hear Paul as well properly.
and then
Okay.
louder in.
Paul, could you walk us through this? What we're looking at right now? I think it's a loop in the rectosigmoid junction.
We're in this thing. Oh, you can hear me on this thing. I can hear myself.
Yeah, we can hear you really well.
So what we've got is a loop forming, and what we're going to try and do now is just advance slowly. Advance slowly. That's the withdrawal. I said advance. Advance slowly. Slowly. Slowly, even slower than that. Slow. No air. Good. Keep going nice and slow. Nice and slow. Nice and slow. Nice and slowly. Stop. Now, just pause there. Check on the patient. Have a chat to him. just wait. How much? Small. Right. So take a nice deep breath in and out. In and out. Slowly. So what we do is get him to breathe in nice and deeply, nice and slowly, relaxing his shoulders as he breathes out. Because what we need to get is the tip of the scope above the apex of the loop. Once he's done that, then he can reduce the scope. So it's getting close now. Now what he can do is slowly apply clockwise torque, tip down and draw back. Good. Clockwise torque. And draw back a centimetre. More. That's it. Stop. You don't want to lose the ground. Now go forward. Maintain the torque. The crown is going. Your neck. You are going to hurt yourself as well. That's it. See how that brought it round? Suck, tip up and suck. But I need you to do this because that'll make it come into view. See? Just by getting you to turn brings it into view. Relax. Now you've caught the scope onto the mucosa. Come back. Release. Go. Now you can go. What I did, you sucked on the mucosa, it got trapped, took the bung off, that released the mucosa, then you could go forward. Keep the tip up, but you can. It's a fine art that is you can blow at the same time as sucking, and I'll show you how to do that. If you want to, I'll show you on that little bit of liquid, but it's something that I wouldn't worry about too much. Stop. Ask him how he's doing. How much? Okay. So, what are our options? Okay. So, the tip of the scope, according to this, is not above the apex. Only just. Okay. So, if you actually get the person to come onto his back, that then will apply the clockwise torque that's needed. Okay. So, if you ask the team about.
Paul,
Yes.
can you just explain the scope guide, what you were telling him?
Right. So, if you look at the scope guide shows you that the apex of the loop is at the same height as the tip of the scope. Now the patient's going over onto the back, so you're applying clockwise torque. Now if you look at it, you can see how anteriorly that it went, the apex. Now what we need to do is change how the arrow is pointed on the scope guide. Yes, madam. Scope guide, arrow, arrow. Don't do anything. Hello, can you hear me? Hello? Right, scope guide is still pointing wrong. Slowly does it. Scope guide is still pointing wrong. Arrow. Blow at the same time. Stop sucking and continue to blow. That's it. Now go. Good man. That's good. More. Anti-clockwise. 1, 2, 1, 2, 1, 2. Can you hear me? They'll get this thing right and then I'll be done.
Yeah, we can hear you. Yeah, we can hear
So
you.
we're just going to do anti-clockwise. Right, look, if you go anti-clockwise, that's it. More, more, more. Keep it going. That's it. Good. Suck. Suck. Good. Tip down and then you go. Good. You're trying too much too quick. Slow down, remember? Pause. Pause. Stop. Stop. Just relax. Stop. Just relax. How you doing? No. You said no. No pain. Oh, that's all right. Right. Keep going. Arrow. More. One more. Yeah, that's it. No. That's better. Yes. Brilliant. What's happened? Keep going. Anti-clockwise. You've caught the mucosa below you. Stop. Watch. Stop. That's it. Good. Back on. Little bit of air and then go. Anti-clockwise opens it up this way. That's it. Go forward. Go forward. Keep going. Keep going. Blow. That's enough. Just feel your way. Go forward. Slight 5 degrees of clockwise. Stop. Good. Stand up tall, man. You're doing really good. Go forward. Go forward. Go forward. Go forward with the scope. Right, if it's not going forward easy, put gel on the scope. Here. More of this. On the scope. By towards his anus. Yeah. Slow it down. Okay. So what can open this up for us? What can open that up for us? No. what else can open it up? Change position. So what position do you think would open up somewhere that looks like it's either mid-transverse or it is hepatic flexure? So which position? Why? Because it drops the hepatic down. Okay. So yeah. Good. Now you can, if you go forward, remember I wanted you to go anti-clockwise before. Go forward and now go anti-clockwise as you go over that fold. That's good. Go forward, slowly anti-clockwise. Slowly. More, more anti-clockwise. Now tip slowly up as you go more anti-clockwise. Tip slowly up. That's it. Anti-clockwise, clockwise. That's all it is. Clockwise. Anti-clockwise, clockwise. And then it goes round the bend. Okay. Stop. You're blowing. All the time you're blowing. Take the air down. Take the air down. More, more, more. Good. You've caught the mucosa.
Paul, is the patient right lateral?
Patient's in left lateral.
Left lateral, okay.
The issue that you've got is the scope guide is telling you wrong. There you go. Mid-transverse, according to the scope guide. Air down. Take some air. Suck. 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 Tip down. Suck. Good. Clockwise. Good. Suck. Good. Stop. Talk to the patient. Yeah. Good. So what's the guy's symptoms? Why are we doing it? Bit of air. Not air now. Stop air. Right, now go forward. You can see where to go. Yeah, you can see where to go. And you've stopped the air, you see. So it allows the bowel to relax. Keep going. It's over and down, down. So what you need to do is, yes, excellent. Slowly, slowly. Good man. You're spot on in what you're doing. You're doing exactly what you should be doing. Now go through and allow it to turn. Support with this arm. That's it. That's it. Go on. More. Good. Just check you've not got the little wheel kick back. That's okay. Yep, that's good. Okay. Right, so we're in the right place, taking your time, really good. What else could we do? What are your options? No, in this instance, it's spasm. So what would be good down there to help the bowel relax? What kind of water? Water. Put some water in. Yeah? I'll get out the way. I did kick it under your foot before. Just take your time. Good. So what are the options? We've done the water. What are your options? We've done the water. So if we put him onto his back, keep your eye on the screen, you're dropping back. Keep your eye on the screen, you're dropping back. Oh, okay. Stop, 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 stop. I said stop. Stop, just stop. Right, let me show you something. No worries. No, just stand there. Just stand there. You've done brilliant. Right, you look at the scope. Nothing wrong with the scope as you've got it. Right, we're just going to take that out and put that down here just for a second. So that scope can sit onto the bed. Alright, not a problem. The little wheel is neutral. Wait. You asked about taking the air down, so the air now is there. Right. Just a little quiff of air. Right. Now you kept looking at this area here. What do you think that is? Yeah. What do you think those little friggly bits are? Okay. Man, know your bloody landmarks. Know your landmarks. You've been there for 5 minutes. Very good. I got some pictures to show you. I got some pictures to show you. Good man. Yeah. Come out. So far, provisionally, come out. Good man. How's it been? Very good. I brought my granddaughter with me and my daughters with me. Come out. Yeah, yeah. Keep them on the back for withdrawal until you get to the descending colon. Then put them back in their left lateral. Yeah, it stabilizes. So, hello. Can I just explain? Because if he was on his right, left hand side, scope would come here, and then as he gets to the hepatic, the bowel would drop off. If he's on his back, it's more controlled, the bowel just slips off. As he comes here onto his left side, then if he actually continues, as he got to the sigmoid, that'd just drop off. Where then if he goes onto his left side while it's here, it'll just sit there, and then you can come out the sigmoid. He's too serious. When I quiz him, he goes, right, blow, blow, right. Now go back in, yep, suck, and blow. Both at the same, and stop sucking, and blow. Let me show you. I'll show you on the puddle just beyond it. No worries. Let go. So you've done that one. So you get it. See the little puddle? That's there. So you blow. Just blip suck. See? It's very, very. You don't need to get it all gone. Watch the scope. Watch. Yeah. So all it is, you're coming back with a scope, and all it is that you're doing this. And if you come back and you want to be fancy, all you do is do that, I do this, I do that, I do this. Yeah? All it is just little movements of the wrist. And that's what I was going on about. I could show you and demonstrate, but it's pointless demonstrating something that you're all not going to be able to repeat. You're better off, I think, doing what we've done here, which is he does it, but he finds it difficult. I take over and just show him, but give the scope back. Yeah, I brought my granddaughter. Oh, so funny. She's come here. She's 8. 8. Yes. Left side when we're in the when we're in the descending, which is any second, suck down, suck, and stop sucking. Suckara, 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 suckara. Come on, man. Been coming years and you don't teach me until now. I'm a geriatric now. That means old. I should, but he doesn't teach me. Yeah. Oh, man. Suction artifact. Stop. Stop. I have this thing where I'll say it once nicely and then I'll say it abruptly. She'll tell you. Stop. Left lateral. He's coming out. What? You want me to follow you? No, no. Sad. It's going very well apart from this reprobate Wazim. He's a right scoundrel. Which is that again? Oh yeah, Siobhan. Siobhan's got it. I will do. I'll sort that now. Right. Right. Stop. This is the point where you look at the scope. So we're just coming into the rectum. Can you see? So ah, that's what you're gonna do in a second. But you're gonna tell him first. You're gonna talk to him first. Tell him you're going to retrograde. Okay. So come back. Keep your eye on the screen. Come back. Keep your eye on the screen. Come back. And rotate. Now, little wheel back. Little wheel back. That's forward. Little wheel. That's the little wheel. Yeah. Back. Yeah, all the way back. Big. Let go of the little wheel. Big wheel back now. Advance the scope. You're advance the scope. Clockwise torque.
Dr. Mansoor, can you hear us? We can't hear you. Can you switch on the mic?
Right, stop. Good. Now relax all the wheels. Stop. Stop. Now relax all the wheels. Relax them. Don't force them.
No, we can't hear you. Dr. Mansoor का mic on कराएंगे?
जी
आप बोले आप
Now we can you hear us?
यस
जी
यस
आपको
यस
सुनाई दे रहे हैं।
हाँ हाँ जी जी जी
मेरी आवाज आ रही है इसने?
जी जी बिल्कुल आ रही है।
अच्छा, हम ये केस है यंग फीमेल है जिसका सीटी स्कैन में जो है लोअर एब्डोमिनल पेन के साथ थी और सीटी स्कैन में फाइंडिंग थी कि असेंडिंग कोलोन की और टीआई की थिकनिंग थी। So Dr. Sultan did very well. He negotiated very well. Rectosigmoid junction. He did the retroflexion, and he was stuck at speedy flexure. So I helped him, and then after crossing the splenic flexure, then he went directly up to the hepatic
Cecum.
cecum. And he was actually concentrating to negotiate the hepatic flexure, which he did very easily. Then I helped him again to negotiate the ileocecal valve and get into the terminal ileum and got some biopsy. And now he is withdrawing the scope. So we are in the process of withdrawal. तो अगर पहले से कोलैप्स हो तो फिर उसको मजीद कोलैप्स करने की
जरूरत
आपने
नहीं है।
देख लिया पेशेंट का एब्डोमेन भी सॉफ्ट है क्योंकि अदरवाइज जो है आपका ये व्यू ऑब्सक्योर हो जाएगा।
सही
एंड अब आप वापसी में भी जो है ये फॉरवर्ड में भी देखते हुए आ जाएंगे कि कोई किसी किसी का ये
हेमोराइड्स तो नहीं। और यही जगह है सर, दिस इज आइडियल साइट फॉर हेमोराइड्स। जब
हाँ हाँ
जहाँ पे हम खड़े हैं यही है जी।
now you can take it out.
थैंक यू सर, थैंक यू।
थैंक यू। आसिम आवाज आ रही है?
जी 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 थैंक यू।
थैंक यू वेरी मच।
थैंक यू सर।
सर साइन आउट जी नाइट सॉरी जब आप बैठिए